How to feel comfortable undressing at the doctor's office. Undressing at the doctor's office can be intimidating, but if you relax your mind and trust in the doctor's professionalism, you can handle it. Doctors see thousands of naked bodies in their line of duty, and while you may be apprehensive about the vulnerability of exposing your naked body to a stranger, remember that they may need you to undress to properly examine you and that they are there to help, not judge. Method 1: Getting ready ahead of time. 1. Ask what you can expect. Asking the doctor's office staff what you can expect in your upcoming appointment will help alleviate anxiety, because you will have a good idea what you'll encounter during your visit. If you're having a specific procedure done, watch some videos and read articles about how the procedure is conducted, why it's done, and even potential complications. Your doctor's office manager may be helpful in directing you to resources that are specific to your visit and your doctor's specialty. The doctor or nurse should have no issue explaining the process step by step to you. Also, especially for younger patients, asking the doctor to explain every step of the appointment or procedure as it's being done can significantly reduce anxiety and discomfort. 2. Arrange to take someone with you. Consider bringing your partner, parent, or a close friend to the doctor's appointment with you. Bringing a companion with you for emotional support can be just the boost of encouragement you need. Your companion will also help alleviate your anxiety by being a loving and familiar presence. Understand that you will likely have to expose yourself to this companion, so make sure that you're comfortable with them seeing you in any state of undress. 3. Take a shower. While it definitely isn't necessary, you may be more comfortable with undressing at the doctor's office if you take a shower or bath beforehand. Perhaps you want to shave your face, legs, or underarms as well. This is entirely to make yourself more comfortable. Your doctor is used to seeing all kinds of bodies and types, and whether you shave or shower is of no importance to them. 4. Know your rights. Under a patient bill of rights, patients are guaranteed certain protections about receiving fair treatment, their personal information, input in making medical decisions, and more. In some states these are laws, and others they are signed proclamations by physicians. Knowing what protections you have can be empowering. Ease your anxieties about your doctor visit. 5. Interview your doctor. Nowadays, who we choose for a doctor is largely determined by insurance, availability, and proximity. We often don't even meet the doctor before our first appointment. It doesn't have to be this way, though. You can call a prospective doctor's office and ask to schedule an interview appointment, as you'd like to make sure you and the doctor are a good fit for one another. If the office staff tell you that isn't possible, thank them for their time and call another office. You will likely have to pay the doctor for their time, so be prepared for a visit fee. 6. Communicate your religious needs. You may be nervous about undressing at the doctor's office because of your religious beliefs. When the appointment begins, simply tell the intake nurse that you are uncomfortable undressing for religious reasons. Medical personnel have been trained to sensitively and respectfully accommodate cultural and religious needs, and this should pose no issue. Method 2: Managing your appointment. 1. Explain your preferred pronoun. If you are gender variant, begin your appointment by telling the nurse or doctor the correct pronouns to use when speaking with you, the name you are to be called, as it may differ from that on your insurance card, and how you refer to your body parts. If you are comfortable with gendered anatomical language, let your doctor know that as well, but reiterate that you are firm that your pronouns and name reflect who you are. Some hospitals or larger practices employ trans health advocates or experts. Ask if one is available to assist you in making and managing your appointments. Many times they will contact office staff before your appointment to address your name, pronouns, and preferred body conversations. If you are a trans man, you might consider going to Planned Parenthood for gynecological exams. Also, wherever you fall on the spectrum, consider going to LGBTQIA health centers for your medical needs. 2. Bring a distraction. Distracting the mind does wonders for alleviating anxiety and even helping block out pain. Bring something engaging to do with you while at the doctor's office, which should distract you and calm your discomfort a bit. Make sure that whatever you bring is not noisy or distracting to others. Books and e-readers are great options. Smartphones and tablets are also great to bring along. You can surf the web, play games, or explore other apps. 3. Ask for a nurse. Some patients are more comfortable if someone of the same gender is present during the appointment. If you are a female being examined by a male doctor and you need to undress completely, you can request for a female nurse to be present, and if you're male, of course the same is true for you. If no nurse is available at that time, you may ask for a new appointment or an alternate doctor. Usually this is unnecessary, but you have a right to feel secure. 4. Manage the power dynamic. A doctor that doesn't seem interested in listening to your concerns, talking with you, or who has one foot out the door can be off-putting and make you pretty nervous. This may make you even more uncomfortable about undressing for an examination. Let your doctor know how you're feeling can go a long way in helping alleviate your discomfort and improving the power dynamic between you both. If you're interrupted, simply say, "May I finish talking, please?" If you're uncomfortable with how you're being treated, say so. "You seem to be pretty distracted and I'm uncomfortable with the idea of undressing for an examination because of it." 5. Exercise your option to decline. Although you've been asked to disrobe, completely or partially, and to cover back up with a gown or large paper sheet, you have the right to decline. No doctor or nurse can force you to disrobe for an examination. Politely decline and ask for an alternative to disrobing. You can say, "I'm uncomfortable with undressing here and choose to keep my clothes on. What alternatives do you suggest?" The nurse may tell you that you have to disrobe so that the doctor can examine you. You don't have to disrobe for anyone unless you choose to do so. You can say, "I appreciate that you're saying that taking my clothes off would make the examination easier, but how about the doctor just lift up my shirt as necessary?" As a compromise, you can request a gown or sheet so that you're covered but still accessible for the doctor. 6. Stop the appointment. You have a right to stop the appointment or examination at any time, which must be respected by doctors and nurses alike. The only exception to this is if you are in the middle of a procedure that would put you in an unsafe position were it not completed, or if equipment is being used that makes stopping immediately an impossible choice. 7. Don't be embarrassed by biological reactions. Your body may react to your anxiety about undressing, the temperature of the room, or even the doctor's examination. While these reactions are not probably what you'd hope for, they're nothing to be embarrassed about. Your doctor understands that the body has varied reactions and that your reactions aren't at all sexual. Some common reactions are erections, hardened nipples, underarm odor, and flatulence. Method 3. Becoming comfortable in your skin. 1. Deal with your anxieties. Think about what it is that is worrying you about undressing at the doctor's office. Once you've identified the root of your anxiety, you can start the process of dealing with your worries. You might find that your anxiety is dramatically reduced simply by identifying the cause. If it isn't, consider talking with a counselor to help you work through your anxiety. 2. Give yourself permission to be nervous. It's normal and perfectly acceptable to feel nervous about undressing at the doctor's office, especially if this is a new experience for you. If you're nervous, remind yourself that your doctor is a trained medical professional that is there to give you a routine examination, one that they've given hundreds of other patients. Take a deep breath, try to relax, and your appointment will be over before you know it. 3. Learn meditative techniques. Meditation helps regulate breathing and calm the mind. Learning a few simple meditative techniques will help calm your anxiety, will help you focus when you're nervous or uncomfortable, and will help you control noisy thoughts that might be distracting you. Fortunately, there are books, websites, videos, and local centers that can teach you a variety of meditative techniques. If you find yourself feeling uncomfortable, close your eyes and breathe. This simple action encourages you to stop, quiet down, and instantly diffuses anxiety. This is especially helpful during any uncomfortable procedures, too, such as a pelvic or rectal examination. 4. Communicate your gender variance. Medical personnel are obligated to treat you with respect and dignity, and with that, address you as the gender with which you identify. You might be uncomfortable undressing at the doctor's office because you identify as a gender other than cis, male or cis, female and do not want to be in a vulnerable position of undress. Remember that these are medical professionals who are not there to make judgment, only to assist you medically. As always, you have the right to ask for alternative solutions to undressing or stop the appointment should you become too uncomfortable. Communicating about your medical needs and issues with your doctor may be uncomfortable also, as some of the conversation may use verbiage that relates to biological sex. Your doctor should understand this and be appropriately patient. 5. Addressing past trauma. You may have experienced physical, emotional, or psychological trauma in the past that makes undressing or disrobing in front of others an anxiety-producing experience. Communicate this, as you are comfortable, with the intake nurse so that they can pass along to the doctor that you will require accommodations, such as not undressing. Medical personnel are bound by confidentiality rules, so they will not share what you tell them with anyone other than those in the office that must know, such as the doctor.